Steyn. Join me as I do interviews with leaders in the field of artificial intelligence from across the world. We speak about the business relevance of artificial intelligence, and we also speak about the future. Is it to be feared or to be embraced? Please subscribe at my website for updates on future interviews. When I first saw this person's profile on LinkedIn, I knew that I had to have a conversation with her. She is a yoga practitioner and teacher who states that she is seeking enlightenment in the AI ethics space. Joining me today from North Carolina is Chhavi Chauhan, and what an impressive resume she has. She earned a PhD in molecular biology. She is an ethics advisor at the Alliance for Artificial Intelligence in Healthcare and an AI policy expert at the AI Policy Exchange. As the Director of Scientific Outreach at the American Society for Investigative Pathology, she focuses on improving the quality and impact of science published in the society-managed journals, namely the American Journal of Pathology and the Journal of Molecular Diagnostics. At the latter, she is Director of the Continuing Medical Education Program. This is a conversation that I believe you will find very informative and fascinating. We touched on many important issues such as artificial intelligence in healthcare. Will it replace or enhance the work done by doctors and medical care professionals? We spoke about the lack of regulation of AI in healthcare, especially as it relates to the COVID-19 epidemic. We spoke about bias, diversity and inclusion, and we also touched on privacy and safeguarding the future of our children.
Chhavi, it's in North Carolina. Good morning. Yeah, it's almost evening. It's good to see you. Thank you and welcome. There's so much I want to ask you. I mean, if I look at your profile, it's healthcare, it's artificial intelligence and yoga thrown into a hat. So tell us about that because it's fascinating.
Yes, and thank you, Johan, for this opportunity, and I'm very glad to be here today. You're absolutely right about the fact that it's an interesting mix if anyone looks at my profile. And there's one thing I want to say about that. So early on in my career, it was a process of elimination. Like, I didn't know what I wanted to do. So I would know very clearly what I didn't want to do. But lately, it's all been guided by my passion. So whatever you see on the LinkedIn profile is all my passions. So just as a brief background, I'm a trained researcher, and I have done my master's in biotech. I have done my PhD in molecular biology. I have worked as a researcher at the NIH, and that's when I really got interested in scholarly publishing, and I transitioned into, working with the society I'm currently working with. Education is a huge aspect that I focus on, and that describes my new role of Director of Scientific Outreach at this organization. I have always been very mindful of my surroundings as a kid, and growing up in India, I had several opportunities to just imbibe mindfulness from people around me, right? And I would see my parents performing yoga and sort of integrating it in their lifestyles. And I can't even tell you at which point I gravitated towards it, but I can tell you that people around me, and especially my husband, could notice the difference in me and my personality, how grounded I was, how well I could think when I was practicing my yoga. So it was at that point I decided to learn yoga from the aspect of being able to practice it mindfully without hurting my body, right? And during that journey of learning, I found it to be very gratifying to be teaching it to the others. So that's the aspect of my yoga journey. And then that took me to teaching at the studios and teaching at even some corporate offices. So I still practice it, and I feel like it's a very good way to ground you, to help you connect the different things that you're working on. So not everything is abstract. There is meaning, there's a value, there is a bond between your every activity that you do. And healthcare, I have always been interested in biology, just from my training, and now I'm in close contact with a lot of pathologists, and people working in the molecular diagnostic space. And we publish a lot of those articles. So I just every single day learn so much in the healthcare sphere. And lately, I started realizing how much is missing there, what are the gaps. And I started interacting with these great personalities to get their take on it. And within, amongst those interactions, I think I started sort of defining my passions and the gaping holes that I wanted to address. So one of those things that recently happened, actually in the beginning of 2019, for one of the journals that I work for, we introduced a new title, a topic category of computational pathobiology. And trust me, despite my training in so many things and my deep interaction with the pathologist, I had no idea what it meant. So essentially in 2019, I took it upon myself to educate myself about computational pathobiology. And as a result of that, I have been building my network, talking to these people who are doing anything in this field. And I have identified several aspects that we need to improve, we need to work on, because I feel like the healthcare system is far behind in the AI and integration of AI curve. Whereas, that's one field where integration of AI is needed. And so I'm currently working with some great professionals in the area, and we're working on synthesizing a theme issue where we will have a bunch of articles on computational pathobiology, including the aspects of, when you're analyzing digital images, there could be variability between devices, how to address that. And you'll be very surprised to know that, and we've published articles like that, that the junior pathologists can make certain mistakes as they get more and more trained, and experienced. They get very adept at picking out what the pathology really means. And as the AI is being developed, it's found that it sort of performs better than the junior pathologist, but in many cases, it's not able to beat the trained pathologist yet, right? So there's this huge debate. So there's definitely scope for improvement at the human level. There's scope for improvement at the AI level. So we're sort of delving into some of those aspects. So that's the healthcare part. And one of the things that I noticed when I started attending these conferences was, especially early in 2019, that no one was really talking about the ethics of AI as they apply to healthcare. And to me, that's an integral component, and I mean, all these talks were extremely fascinating, and I understood so much, and I absorbed so much, and my just knowledge grew so much. But at the same time, that was like a gaping hole to me. So I started networking with people, trying to find people who were doing anything in this domain. And during these interactions, I came across like-minded people who are passionate about AI ethics. And that's how I got involved with the Alliance for Artificial Intelligence in Healthcare, where I'm an ethics advisor. I got involved with AI Policy Exchange as an advisor there. So that's, in short, my journey so far.
Tell you, I had to bite my tongue because there's so many places I wanted to interrupt you and ask you questions. And I thought, no, wait. That's why we have this call and potentially, hopefully, many follow-up conversations. So, Chhavi, I mean, I spoke at locally in Johannesburg last year at a AI and healthcare conference where I met some interesting healthcare professionals who's working in the field. So you get the technical people who are techies and then they do some healthcare work, or you get the healthcare workers who are now embracing this technology. So it was interesting to see those perspectives. But what I said, my talk was about patient care in healthcare, when it comes to AI. So almost call it custom experience, if you would. And as I developed my talk, I realized, for instance, in banking, I love the idea that AI can help my bank to better serve me, to give me better products, to better manage my finances and all that. But when it comes to healthcare, even though money is close to the heart, healthcare is closer, because I can't buy my health, even though I can buy things with money. So, and then, I know you've got a young child, I have a young son. If I think about their future and their future health and longevity and quality of life and all those things, I'm excited what this technology can do. But then we get to the ethics, all the other things, and implants and who knows what. So, and that's the dark side as well. So I'd love to hear your view on that. I mean, I think maybe let's tackle ethics, which is a huge, huge topic, bigger than in this technology than most people realize. Let's start with ethics and maybe talk about how you see the future and when it comes to what this technology can do in your field.
That's a very interesting point, Johan, and I completely agree with you. And that's one of the things that sort of, made me keep thinking about this topic over and over again. Just the fact that the healthcare, I mean, you cannot dissect out healthcare from our well-being, from our everyday life, right? And we're noticing that it's been quite a few years since we have been using healthcare trackers, like fitness bands and stuff like that. And especially in COVID times, because of the pandemic, people are homebound, and it has been taking a mental as well as a physical and emotional toll on our well-being. And we are always on these electronic devices, I want to say pretty much the whole day, whether it's for your work, for your meetings, for interaction with families, right? And there's so much that comes with the use of any technology that we're using these days that we understand. And there's only so much. There's a lot more that we don't understand, right? For example, the recent ban, so my parents are still in India, and TikTok recently got banned there, right? And there is a talk about in the US, they're considering whether it should be banned and all. So for me, it's very important, and especially coming from a yogic background where I want to have a connection between my mind and my body and my every single action, the fact that I do not know what's happening to whatever I'm transmitting, whatever I'm relaying, my messages that are being sent, are they being altered by someone? Are they being stored in ways without my consent, which of course I haven't given, but maybe in one of those 2, 3, 4 page long consent forms, I just ticked, yes, I do, I agree.
We all do that.
I know, so it's something very disturbing to me, right? And if we are sharing some joyful events with our families, our relatives who are far away from us, and going back to your statement of having kids, right? They're the future of humanity. And also I want to safeguard their I want to make sure she has a safe and secure future, and not something from her past is not going to come and bite her because I wasn't careful enough to safeguard her identity, or so I don't want to be sharing what my child is doing with the random folks who may alter the content or misuse in a different context. But at the same time, I want to have the freedom and the liberty to share her growing up with my parents, my husband's parents, because they're missing out all these events in her life during the pandemic, right? So I think it becomes very important to understand what goes into you sending out data out there. And it becomes very relevant when it comes to healthcare, because especially in a setting like the USA, where we have the insurance providers, and a lot of what services you can get depend on how much your insurance can cover, right? So if you share data like genetic predisposition, and you don't want to be excluded by an insurer or not covered by them solely by the fact that you have a genetic predisposition to a particular disease that they may not want to cover. So when it comes to healthcare, there are several layers of regulations sort of missing. There's every single step of the process. And, I know it's very nicely protected right now, and that's the reason why there has been a slow process of adopting AI in healthcare. I mean, it's all for a good reason. Um, but at the same time, there's so many steps where people who want to misuse the information can come in and market your data or misuse it that you want to avoid. So it becomes very imperative for us to focus on healthcare. And like you mentioned, there are concerns about longevity, and now we are dealing with this pandemic where there's a global effort to pool the data because no one really knows what this complex disease is doing, how it's working, the epidemiology, the demographics. There's so much at stake, right? But all these, the lack of regulation of AI in healthcare has been impeding our collaborative efforts, the ability to share these data and to be able to combat this pandemic. So that's something that speaks very closely to me, and I want to do something about that. So yes, AI is one, healthcare is one field where adoption of AI is critical, imminent, but it's essentially a field where we should have put regulations in place like yesterday, and they're nowhere to be seen yet, unfortunately.
Hopefully this pandemic will thrust us into this endeavor to get ready for the next one, because I think we will in our lifetimes most likely see cycles of these pandemics potentially. Just when we spoke about our children, my son in the last few months learned how to use Siri on his iPad, and it's fascinating how Siri accurately picks up what he wants. And then I started what I call IoT-ifying my house. So I've got a smart speaker, and I've got the lights I'm using now, my kettle and other things I can give voice commands to. I didn't show him. He just looked at me and listened to me, and now he's giving voice commands. And before I know it, the kettle's boiling. For what? Because he's not going to make me coffee. But then and it brings me to what I wanted to say. With Lego, for instance, Lego has this, and I can't for the life of me remember what they call it now, but a child can ask it's an Amazon speaker to tell him or her certain stories. And for instance, if you don't say please, it doesn't obey what you say, so it's all good. But there was quite a big issue around the protection of the privacy of the child. Because if you think a child essentially confides in these devices, they see it as a friend. And if a predator can pick up on what the child likes, where he or she goes, etc., it's something, as a parent, you don't even want to think about. So the regulation, the ethics, the data, privacy, and then when it comes to our own health and well-being, it's so massive that it almost keeps me up at night, But then there's also the potential. So what I want to ask you next, because I want to come to the yoga and the spiritual side of things, which is a big interest to me, especially in this field. What would you say to healthcare workers? Because obviously not everyone wants to become a technical expert or AI expert, but I think in every knowledge worker's life, and so much more in a medical professional's life, they need to be aware of this kind of technology. So even if they don't want to become algorithm creators, etc., but what would you say to almost every healthcare worker out there? Should they embrace this, and how do they do this?
Right. And that's a very complex and interesting question, Johan. You're right on point over there, because there is so much variability in the adoption of AI at different levels, right? So there is no one size fits all sort of solution, right? And then there are differences in each and every setting based on how much money you have, what kind of instruments you have access to, are you in a resource limiting setting, and that changes the messaging to the healthcare workers tremendously. So first and foremost, what they realize, they are the lifeline of the patients who come in, because unfortunately, the patients don't even get to spend as much time with the doctors that they want to see as they do with the healthcare workers. So they do this amazing job of making the patients feel at home and to connect with them, to let them know that they're there for their mental and physical well-being, and they're going to get them better and discharged, right? So I would just say that, and this applies to me as well, you have to embrace change. You cannot be reluctant to change. Yes, there are changing technologies, and it has happened. I'm in the scholarly publishing field, right? In the past few years that I have joined, it has changed. The entire landscape has changed tremendously. So instead of just believing, no, this is the set way of how things are done and this is the only right way, you have to be changeable. You have to be adaptable. You have to embrace what the new technology has to offer. But at the same time, I would say, question every single technology that you use. Just because somebody is offering it to you, saying this is the gold standard that is accepted by your institution, or we are implementing it here because this is the gold standard that has been implemented at one of the world's biggest centers, just don't accept it. Ask them, how does the system work? What are the pitfalls? What are the potential vulnerabilities, right? You talked about privacy, you talked about security, and those features are very critical, especially when we are moving on to the use of new technology. Of course, there will be differences. Like, for example, when I'm talking about pathologists looking at slides, and now that they're using digital pathology, and I'm very thankful for the use of digital technology because it has empowered the pathologists, especially in the time of this pandemic, to sit at their home or a home office and be able to make these decisions on which the lives of the patients depend. But at the same time, you should be aware that if you're looking at an image on a laptop versus a tablet versus a mobile device, there are some variabilities just inherent to the interface that you're using. So please do not ignore that. So definitely question as much as you can, embrace what is being offered to you, and question about how the models really work, and voice your opinion. And I feel like each and every individual in this world should be empowered to voice their opinion, and that's the only way that we can integrate AI, ethical AI, in healthcare.
Absolutely.
We have to make it.
Yeah. Oh, sorry. What would you say? And because I get this question a lot, but I work more in banking and financial services. What if a healthcare worker or a doctor tells you or asks you, will we lose our jobs because of this technology? It's a relevant question and on everyone's lips. And I don't think it's an easy answer, but how would you approach that? How would you answer them?
Right. So I have seen this question resurface like you have, right? And I'm a strong believer of human-centered AI. And I believe that no matter what you do, you can't just take the humans or the humanity out of the AI, right? Especially as it applies to healthcare. Like, for example, in banking and financing, yes, you can automate a whole bunch of things, even to the extent of depositing your checks, withdrawing money, right? Sitting wherever, making wire transactions. But the reason behind using AI and collaborating it and making it, it's essentially to allow collaboration, right? Especially in these settings, right? For example, if you're sitting in a pandemic epicenter, right, where everyone is just dealing with COVID-19, which is the crisis for all of us. But at the same time, somebody else is in urgent need of advice. He or she may not be able to go to a hospital without endangering their life, right? So if you have access to a pool of doctors who can virtually examine you and give you first, second, and even third opinion to guide a regimen which is personalized to your health and well-being, I think that is something that, I would jump at that opportunity, right? You're absolutely right about a lot of people thinking that incorporation of AI may lead to them losing their jobs, but I sort of don't see it that way, because you will need these trained technicians, trained doctors, trained healthcare workers to continuously assess how well the AI is performing, give their input to keep improving it. And of course, we need someone human to sign off on things because it's human lives that we are talking about. So no, I don't think that these jobs are going to go away. I just feel like these healthcare workers will feel more empowered and even gratified, because they will now get the opportunity to treat the patients the way they envisioned they would treat them going into the profession. You know, a lot of doctors are always like the burnout rate is getting higher, especially in pathologists, and they feel like they're not able to make that connection with their patients, the guiding feature that got them into practicing medicine to begin with. So by automating a whole bunch of things, when the doctors are not sitting taking notes and just focusing, transcribing those, so you include and improve on that human aspect of treatment, which unfortunately has gone missing over the years.
Right. I call it, or people call it cobotics. In other words, and you've just alluded to it, in every job, there's a lot of stuff we need to do that we wish we didn't have to do. And it's around reporting and admin and those kind of things. If that can be automated and I can focus on the things I'm really good at and I really love doing, then this technology makes sense. I often think about 10 years ago, my mother and her mother both passed away within a month from each other from cancer. And I remember, yeah, but it opened my eyes to, because people like me, I try and avoid a hospital as far as I can. I know it's somewhere there and there's people suffering, but you go on as if with your life as if you're never going to die. And then they say you die as if you've never lived. But I remember seeing them suffering and when they came to passing, and I often think, I don't care how smart artificial intelligence becomes. I want a human to be holding my hand when I'm suffering and when I'm passing. If that AI can help them, as it already does, to better diagnose and better prescribe, absolutely. But that the aspect of empathy and what, I don't think technology will change the fundamentalness of what it is to be human, in my opinion. So and that's where, like I said, I don't want a robot to help me through dying. I want a human being doing it. But before we get too serious, now I want to get to the real good stuff before we end off, Chhavi. I'm going to read you from your profile. A mindful yogini, I hope I pronounced that right, seeking enlightenment in the AI ethics space. Wow. So you've already alluded to some of that. I'm very interested in that. So, you've already touched on it. So let me tell you why I'm asking you. I've always been very interested in spirituality, in the various different beautiful traditions in the world. I actually did theology as one of my majors alongside psychology and sociology. And I've always been interested to kind of bring that back into this field that I'm so interested in. And for instance, how will AI becoming almost like the almighty, all-powerful God, if you would, impact people's view of spirituality, our view of ourselves? And again, whether somebody is agnostic, atheistic, or religious, it doesn't matter. So it's quite a philosophical question, and it's about our opinions. But how do you think the advance of AI, and especially when we come to general artificial intelligence next, and later on the so-called singularity or superintelligence, almost that doomsday scenario? Hopefully we're not alive then. But how do you think will AI impact humanity's view of itself and spirituality, if you would? I know it's most likely another 4 hours worth of talking, but in a few minutes, I'm very unfair. Sorry.
Yes, Johan, it's a loaded question, and it's a very fascinating field, And with your theology background, and I was hoping to gain some insights from you on that aspect. So when it comes to religion, right? My understanding might be limited just on my basis of my belief, but you have studied it, right? So religion is something that's very integral to humanity, and it's been like historically from whatever we know, right? And my understanding is that the basis of religion is trust or faith, right? You would not just agree to practicing or believing in a religion if you do not have faith in what the religion is telling you, or you do not trust. There's the testaments, there are the beliefs, right? So, and that's what I believe, that trust and faith are two principles that are really important to humankind and have been through the course of history. And as we become or move towards that singularity, which is going to be the point of no return, and it's going to arrive. I know a lot of people are they're in denial that this is not the fourth revolution, but we might as well call it the fourth industrial revolution. So it goes back to us believing and trusting and having faith in AI, the technology, as we move forward. And that's where AI ethics comes into place, So whatever AI-based technology we are using, be it in banking, finances, healthcare, democracies, right? Because we're moving on to digital platforms for elections and even campaigning. So for every single aspect of our lifestyle, we are incorporating AI in one way or the other. So we have to be able to trust it. We have to be able to have faith in it. So how are we going to achieve that? We're going to achieve that if we empower every single person to question what are the algorithms that are behind enabling this AI make a decision one way or the other, right? There are no black boxes. There are no inherent biases, which are just so prevalent. Like I see it every single day. I see it in my own life, right? I have a 4-year-old and we talked about it. The other day, she saw someone in a parking lot and she said, that guy does not look handsome. So I was just so worried because, it was someone of color who was over 300 pounds and sluggish in walking, but I didn't want to put bias into her mind. And I just asked her the question, why do you think he's not handsome? And her innocent answer was, he's wearing a man bun. Man buns are not pretty. I mean, it was disheartening to see that my 4-year-old had an opinion about man buns, but that came from her seeing this picture, the jigsaw of ballerinas of different colors that she had put together. To her, every single ballerina, no matter the color of their skin, they were beautiful and they had buns. So only ballerinas could have buns. I could have very well said, oh, just because you think he's fat, you think he's not handsome, or just because, he's colored. So we have to step back from this bias, right? So we all have to make these mindful contributions of not setting our standards to one level, give equal opportunity, equal playing field for everyone, right? So diversity, inclusion is very important to me, and I'm trying to empower my daughter, and at the same time educate her and sensitize her about what else is around here. Like, she has play dates with kids with special needs because she has to understand what that means. I mean, I fail to understand that at times, right? So when it comes to ethical AI and where we are headed, yes, we may be headed towards that singularity, but it's not going to be a doomsday. It's going to be for our own benefit. And it's not going to be a doomsday if we prevent ourselves from making it happen that way. We have to be very mindful in how we are integrating AI. We have to understand the models before they can be implemented. They have to be transparent. And at the same time, we have to constantly assess them, make sure that they remain relevant to our needs.
Yes, we're going to definitely have more conversations, Chhavi. I'd like that. Because
Me too.
I like speaking to the technologists, and they have such relevant things to say. But for me, because technology, I can kind of live without it. I know it's a horrible thing to say, but healthcare and the future of my child and things like that, that's the stuff of life, of being alive. So I'm very passionate about that. So, but I thank you. It's so lovely chatting to you. I'm going to add your details and your links in the video comments so people can reach out to you, and we'd love to follow your work as you publish and maybe speak and do things like that. So I look forward to speaking again in the coming weeks. Chhavi, thank you so much.
Likewise. Thank you so much for this opportunity again, Johan.